Welcome to Sensible Health Solutions, the show where we simplify health and wellness. Join your hosts, Hallie Fields and Dr. Scott Luper, as they share practical tips and expert insight to help you navigate common ailments, nutrition, and overall well-being. Tune in for straightforward advice that empowers you to live a healthier life.
Hello, Hallie.
Hello, Dr. Luper. How are you?
Doing good. Happy and healthy?
Good. Well, in continuing our conversation on autoimmune diseases that you commonly see in the practice, I think that one we should cover that's pretty prevalent out there is Crohn's disease.
Yeah, we see a fair amount of Crohn's.
Okay.
So we got a lot of experience treating it, and I think that's a good thing for us to talk about.
Absolutely. For viewers out there who might not know what Crohn's disease is, can you tell us what it is and what are common symptoms?
Sure. Crohn's disease is a gut disease, and it mimics colitis pretty dang close because there's a lot of digestive symptoms. You get stomach pain and diarrhea, sometimes constipation, sometimes bloody diarrhea, gas and bloating, and just kind of overall feeling horrible. Sometimes nausea, sometimes vomiting. Not really, vomiting's not that common, but it's possible. So just basically gut stuff, guts. That's really what it shows up. Yeah. It's not only digestive symptoms, because since it is an autoimmune disease, there's other symptoms that'll come up occasionally, more general symptoms. And if you see these general symptoms along with this colitis picture, you got to start thinking Crohn's, because there's a real good chance that's what's going on. And the general symptoms are things like joint pain, muscle aches, malaise, fever, and rashes, and two main rashes, and then kind of a canker sore type thing. But
What are the two main rashes?
there's a rash called erythema nodosum, where you get deep, kind of bruised, looking kind of thick, painful spots on your shins or on your thighs. They can sometimes occur up on your trunk or your arms, but mostly they're down low. That's classic for this. Another one is where you get an ulcer. It's called pyoderma gangrenosum, and your skin just basically breaks down. It's like that same rash before, but it gets
Deteriorates.
chronic, yeah, and
Creates like a wound.
yeah. I don't necessarily want to go into all this real graphic detail. We're gonna put people off.
Well, I mean, if they're experiencing some of these symptoms and they might not know,
Yeah,
it might be helpful.
If you got this horrible pussy ulcer on your leg, and then it won't heal, yeah, you should go to the doctor. Okay. Particularly when you got gut problems going along with it, absolutely. And this is a pretty common side effect of getting autoimmune disease of a certain type of the gut problem. It's one of the ways it manifests. So and then canker sores.
Okay.
You know, your classic canker sores, you get that little
in the mouth?
painful little sore. Yeah. Those go along with it as well.
Sores?
Yeah.
Oh.
Now, just because you have canker sores doesn't mean you have Crohn's.
Right. No.
But if you have Crohn's and you have canker sores, if you have gut problems and you have canker sores, then you have to start thinking, I wonder if I might have Crohn's.
So,
and then you get a check to see if you actually have it or not.
You mentioned ulcerative colitis. Is that kind of the step before it manifests into Crohn's disease? Or is that like...
There's a lot of overlap between ulcerative colitis and Crohn's, but they're not exactly the same.
Okay.
Ulcerative colitis has an autoimmune or an immune, an immune aspect to it for sure. Crohn's disease is autoimmune. Mm-hmm. Now, if you get your immune system jacked up so much that it starts attacking the lining of your digestive system, that's an immune problem. But if the problem with your immune system, or rather your digestive system, is because of your immune system, that your immune system is the factor that is attacking, that's literally causing the white blood cells to go in there and damage the lining of your digestive system, that's more Crohn's. Okay. Now, mostly what it affects is the lower part of the small intestine. The way things works is you got your mouth and your stomach and your small intestine and your large intestine. So the small intestine comes first, large intestine comes second. Small intestine's where broken down food is digested and absorbed. Large intestine is where the process of digestion is finished. Poop is basically gathered together and then processed. So the main areas that are affected by Crohn's are the lower part of the small intestine and the upper part of the large intestine. But you can have a problem anywhere from your mouth to your anus. The entire pipe can be affected by this. Mostly, and that lower section is what's affected, but not necessarily.
So with Crohn's, is there also an internal ulcer element to it?
Yeah, that's actually, I wouldn't use the word ulcer necessarily because it's too diffuse. The lining of the digestive system is damaged, is like rubbed raw.
Okay.
That's what it looks
All of
like.
those little felty
Villi are broken down
deteriorated.
All that. So the whole thing is kind of a raw, easily scratched, bloody mess.
Very tender area.
Yeah, extremely tender. I mean, this is just absolutely debilitating if you have a flare of this thing, and it could just wreck you where you can't do anything, can't function. You just have a hard time just getting through the day alive, right?
And so
Like
is it a consistent symptomology, or does it come
Comes
in
and goes.
waves? Okay.
Comes and goes. You get a flare, and then you're better, and then you get a flare, and then you're better, and you get a flare. Usually people flare 2 or 3 times before they eventually figure out what it is.
And what induces these flares?
Well, we should do a show on that.
Here we are.
So your immune system gets jacked up from a variety of things. Sometimes you just have a predisposition to it. People have a kind of genetics that make them more likely to have this, but it's not a genetic problem. Normally what it is we've talked about this before, is people get kind of low-grade infections in their digestive system that stimulate their immune system, and then their immune system runs on its own after that. It just does its own thing, independent of whether you have the infections or not. And so it's an autoimmune disease. Your immune system does the damage, but usually there's a trigger.
Yeah.
And so if there is a trigger, it's fabulous for us because now we have something to treat.
Sure.
Right? We're not just trying to shut people's immune systems down and turn it down. We're trying to get rid of the triggers and calm people's immune systems down to be able to clear it up. And, like that.
Okay, so what are some of the tests you might run to determine these triggers?
So there's no blood test for the disease. It's not like you just run a blood test and figure out what it is. But there are some blood tests that almost always are elevated with Crohn's, and those are the inflammatory tests.
Yeah.
The 2 most important ones are C-reactive protein. A lot of things will make a C-reactive protein go up that aren't Crohn's. Just because your C-reactive protein is high doesn't mean you have Crohn's. But if you don't have an elevated C-reactive protein and you have a gut problem, chances are it's not Crohn's. Okay. The other one's a SED rate. SED rate's otherwise known as an erythrocyte sedimentation rate. And that one is another one, kind of like the C-reactive protein. Lots of things will make it go up that aren't Crohn's, but if you have Crohn's, it almost always goes up. You'll see that going up.
Sure.
So if you get somebody with gut problems, they may have the rash going on, they may have canker sores, you run a blood test and they have an elevated C-reactive protein and a SED rate. At that point, you really need to run or have a doctor do a colonoscopy or an endoscopy and actually run a little camera either up you or down you and take a look at what it looks like. And the look of it is how you make the diagnosis. That's how the diagnosis is made. Now, if they're suspicious it might be something else, what they could do is take a little sample of the mucosa, do a little snip, and then take that and give it to the pathologist. Pathologists can run the test, and they'll make a definitive diagnosis based on what the pathology of the mucosal lining looks like.
Is this more of a whole system issue, or are there certain bacteria that create this problem?
Yes, both of those. It is a whole system issue, and certain bacteria make it more likely to have this happen. So it's not so much certain strains of bacteria, it's more like infections in general.
Yeah.
And you get some nasty strains of this or that, and it'll irritate your immune system enough. And especially if you're having an immune system that's more prone to having being riled up. Some people just have immune systems that are just, made it like an iron skillet. It's just hard to get them riled up, right? And other people, you blow on them and they'll flare.
Yeah.
And so there's that.
Yeah.
So bad disease, lots of
Very
misery.
bad disease.
This is
Very
an
miserable.
unpleasant disease to the max.
And so, is this a constant disease? Is this something that they are sentenced with for the rest of their life, or is there any recovery?
Yeah, it depends on who you talk to. If you talk to the books, okay, the books, and it's incurable.
Oh.
Once you have it forever, and there's nothing you can do about it. That is not our experience at all. Pretty much everybody who's ever come to me with Crohn's disease has got better. Mm-hmm. It's not like you ever get rid of the tendency. If you just lived on Twinkies and black coffee, chances are you're going to get to this thing
and
back
processed
again.
Foods and junk and things that
you're gonna get it.
are
It'll come back.
created not to decompose in the gut.
Yeah, you're going to have to follow a diet that's conducive to healing your digestive system. And you're going to have to take some things that are going to calm your immune system. There's a fair number of medications, biologic medications, that have been developed that will shut down an aspect of the immune system. And these have been a godsend for people with Crohn's because they could take these and really have their Crohn's clear up and not have the symptoms with their Crohn's. Now, the downside to that is it shuts down some part of your immune system that you're actually using or you need to use maybe occasionally. And so people are going to be more prone to having infections and other side effects and problems that go along with the medication.
And be more susceptible to other
Yeah, it turns out your immune system is a
bacterial
useful
infection.
thing, right? Who would have thunk? So anyways, there's a pretty hellacious side effects that go along with these medications. They're not always there. Lots of people tolerate the medications fine, and a few people do not tolerate them fine at all. And they really have horrible side effects with them. So they're problematic. If you can do some common sense kind of things to calm your immune system down, and I'll just give you a short list of stuff that's helpful. None of this is the cure for Crohn's, but all this is a piece of the cure for Crohn's. In fact, you could give me the list. We've talked about these things enough. In fact, let's do this. This is a little quiz. Can you think of one thing that's calming to your immune system?
Yeah, the anti-inflammatory tincture that we create.
Bingo, that's right.
Glycyrrhiza, curcuma, ganoderma.
Yep, let's say that again slowly. So we have come up with a tincture, and it's funny we say we have come up with it because it must have been invented 100 times in 100 different places, right?
Plenty of
because this
people
is the same
are
stuff that
doing
everybody,
it out
it works for everybody, right? So it's not like, we came up with it. But we just put them together and it works. Mm-hmm. And so since it works so well, I'm thinking, why don't we use that stuff that works?
Yeah, why don't we keep giving it out to patients? Why don't we keep
So
using
now
them?
we make it up ahead of time. We have a gallon in the back of this stuff, and we just pump it out, right?
Yeah, so
makes it easy, saves the stuff.
It is glycyrrhiza,
which is licorice
root, and curcuma, which is turmeric, and ganoderma, which is reishi mushroom.
Yeah, so curcuma is the scientific name for turmeric, and turmeric has an element in it called curcumin, which mostly is extracted out of turmeric and used in capsule form. And you can do that.
Yeah.
But we don't actually do that. We use the
We
whole...
have some on the shelf.
We do.
Yes,
We do. We have the ability to use it,
mm-hmm.
but we rarely do. What we end up using more is the actual turmeric.
Yeah.
Now, what's interesting, I have a colleague who went to India and talked to the manufacturers of curcumin. And they're taking turmeric and they're extracting the curcumin out and making, barrels of the stuff and shipping it to the United States. And people buy the barrels and they make capsules out of them. But they have this huge giant pile of stuff that isn't curcumin sitting in a heap.
The other
parts of the herb sitting in a heap, a little heap.
But all of those other bits and pieces have their own properties to them that help with other things.
They didn't know what to do with the stuff. They're not selling it. They're selling it to curcumin. Mm-hmm. So he was just interested. I wonder what the anti-inflammatory characteristics of this other stuff that isn't curcumin. And he did all these studies on it. Turns out it's fabulous.
Right.
They're pitching half the stuff that's good. It's just sitting there in a big pile. So since I know the guy, right?
Yeah. You have an insider.
We get the whole thing.
Yeah.
We don't just use the curcumin, we use the other parts too. Maybe that's one of the reasons why it works so well. Because we're using the whole kit and caboodle. And we're using the licorice root, and we're using the reishi mushroom. Mm-hmm. And they work together beautifully. They all do something different. They don't do the same thing 3 times. They do a different thing every time. And you get this more gentle, comprehensive, calming effect on the immune system. It does not shut the immune system down. The immune system works perfectly fine. It does all the things it wants to do. It doesn't break any aspect of it. It just takes the dial on the immune system and goes, pew, and turns it down. So everything just is less reactive. Is less reactive is what it is.
So
Okay.
along with the anti-inflammatory tincture.
Some other stuff that's common that people listening are going to be able to get access to. Not that you should treat this at home by yourself.
No, you should always seek the guidance of a medical professional, a doctor.
Yeah, now having said that, there's some stuff that you could take at home that to get the ball rolling on this one. One of those things is vitamin D. Vitamin D is a lovely immune system regulator. It really works nice. It's super inexpensive. The side effects are really, there are no side effects if you use the correct dose. If you use too high of a dose, you can get some problems with calcium absorption. You get too much calcium. If it's bad enough, it'll cause cramps. If it's not quite that bad, it could still be a problem because it'll deposit into soft tissues. You have to take vitamin K along with vitamin D if you're going to get high levels of it. Nonetheless, it's cheap and easy to use, so there's another thing to do. Another one is fish oil.
Fish oil, yeah.
And the most important thing I do with people is run a test and figure out if they have any infections in them, which they always do.
Of course.
Always. Never had a case of Crohn's didn't have infections.
Right, because it's kind of stemming from.
Right. And so
an
then we
infection.
treat the infections with a variety of stuff, mostly herbal things. And then we also work on diet. Diet's super important. And then the diet is going to be eating foods that are easy to digest and to digest them completely. If there was any leftovers, because when you eat food, it should go down through the pipes and then digest completely.
Right.
And then if there's any leftovers by the time it gets to the lower intestine, that's more likely to ferment because of the bacteria down there
And create more bad bugs.
and create the irritation.
Yeah, create more irritation.
And that's what's driving the whole thing. Driving the whole party is incomplete digestion.
Would you recommend chia seeds to somebody with Crohn's?
That's an excellent question because people with Crohn's know that if they eat anything with fiber in it, it's going to irritate them because they have this raw
Exactly.
area, like this almost open wound, or in fact is an open wound.
Yeah, and then the seeds could get stuck in little. Crevices.
No, they don't get stuck; they scratch.
Okay.
So any kind of fiber, let's you eat broccoli,
Okay.
right? And it's got some, stemmy, fibery stuff that kind of holds it together. And you chew it up, but it's still the stemmy fiber stuff won't digest. And as it goes down, it's kind of embedded in, the leftovers, and it scrapes the side of the digestive system because it's, like the small intestine, wherever the problem is. It scrapes, and now it bleeds. And now you have bloody diarrhea
So
because you ate broccoli.
You can't really have them do chia seeds then to help with digestion.
Yeah, no, this is an excellent question. And it turns out that in the long run, broccoli is the prevention. It's the long-term cure for Crohn's. If you can get enough soluble fiber in people and get their digestive system healed and healthy, then they don't have a problem anymore. I mean, they have a tendency to Crohn's, but they never flare.
Sure.
And they never have a problem. They go the rest of their life and they're perfectly fine.
So then how do you get them the fiber without causing the irritation?
You have to heal the wounds.
Okay.
That's what you have
So
to do.
it's kind of like a step-by-step.
Yep, you have to heal those wounds. You got to get the wounds healed so that if you do eat fiber, it doesn't scrape it. And then you got to load them up with fiber.
Okay.
And then they do fine.
So healing those wounds would be taking care of the infection.
No, actually, to give them something that's literally going to cause their wounds to get healed. There's stuff on the planet that stimulates the healing or the thickening because it's too thin and it breaks apart. It's called friable. The memories become friable. So what we want to do is keep them glued together and keep them nice and thick and keep them tough so as stuff goes by, it doesn't rip them to shreds.
So is this where L-glutamine
Yes.
would come in? Mm-hmm.
It is exactly.
Okay.
You hit the nail right on the head. That is the number one thing to take is L-glutamine. There's another thing called gamma-oryzanol that we also do. Gamma-oryzanol is extracted from rice bran oil. Isn't that weird?
Yeah.
Rice bran oil. Of all the things in the world, rice bran oil? Whoever figured this out?
I don't know.
The Japanese people.
They're stretching. Well, that makes sense. They do a lot of rice.
They have a lot of rice bran laying around, and you squeeze it for oil, and then you see what it'll do. And it turns out what it does is it heals ulcers.
Oh.
Not only in the stomach, it was originally looked for the stomach, but also in the small intestine, also in the colon, also in your mouth, also in your bladder.
Wow.
Isn't it interesting, isn't it?
Yeah.
It works in all those places
Interesting.
and heals them up.
Wonderful.
Now,
And-
it's not like you just take gamma oryzanol by itself and suddenly you're healed. It doesn't work that way.
Yeah.
It's a thing that you can take that will increase the chances that you're going to heal, not to 100%, but more than it used to be.
It's
you
just
mix
a
it with
piece to the
glutamine,
puzzle. Yeah.
and the chances go up even
and then
more.
fish oil.
And the chances go up
Yeah.
even more. And you start layering these things in. You calm the immune system down on one hand, and you heal the wounds on the other hand. And you get people moving in the right direction. Usually this is like our first visit or two. And they come back in, I say, how you feeling? I'm much better.
Okay.
You got any bloody diarrhea? No, it's all cleared up.
And then at that point, you start
Fiber.
introducing fiber.
That's right. At that point, they're ready for fiber, and you can do fiber.
How long has this taken you before with patients?
Couple weeks, not long.
That's incredible.
I don't know, not really.
Really? Okay.
I don't
so
think so.
humble.
No, it just goes pretty quick. Yeah, I'm sure there's. I have to be careful. This is not a brag session. We're not trying to say how great we are. It's my experience being what it is. That's what my experience is. So I'm very humble about this whole thing. I mean, the next one I see could not go this way.
True.
And then I'd say, oh, we got one that's different.
Yeah. I've heard of multiple people being, prescribed steroids for theirs, and the steroids being effective for the first few months, and then in the next session, during the next flare, the steroids not having the same effect.
Yeah. Why do you think the steroids work?
The steroids work to suppress the immune system.
Yes,
but
they
then
do.
The immune system kind of builds resiliency to
Yes,
those
it does.
steroids.
It does, in fact.
Right.
Yeah, the steroids are tricky because steroids work very well to knock a flare down because they suppress immune function. And that's great. Now, what they don't do well, or a side effect of steroids, is as well as reducing inflammation, they also reduce healing. Because inflammation is healing.
Is the body.
It may gone so extreme that the healing is so excessive that it doesn't look like healing anymore. We talked about this before. Let me do it for our listeners so they get a sense of what this is. And so let's go we'll go out of the digestive system. We'll go into your house. Okay. So you have your house and you're living there, and then in the corner of one of the rooms, the floor is kind of spongy and there's kind of like mold growing on the wall or some kind of thing. And there's a leak on the roof, and you got this damage, right? And your house is starting to rot from the inside. So what do? You call a carpenter, have him come over. And what he does is he starts pulling the floorboards up and pulling the sheetrock off. And oh, heaven forbid, it's a huge mess back there. It's way worse than we thought it was. And this is inflammation. Because now you're healing, and there's dust in the air, and there's noise, and it's all uncomfortable, and I can't go use my living room anymore, and this is misery, and this is Crohn's disease.
Yeah.
Okay? Now let's say, for example, instead of having one carpenter come over, you have 30 carpenters come over, and they're all tearing the walls down, they're all pulling the floorboards up, and they're all pulling the ceiling tiles off, and now you can't live in your house anymore because you've been driven out.
Yeah.
The inflammation's so excessive, it's all healing, but it's so much that you literally cannot inhabit your house. Now, replace the word house for body.
Yes.
And now you're dead
Yeah.
because you can't live there anymore. That's COVID.
Yeah.
That's what happened with COVID. It wasn't that the virus killed people. It was the inflammatory response killed people because it was so intense and so much. We all had to move out,
Yeah.
right? Who had
had
in
to
that situation?
evacuate.
You had to evacuate. Yeah, and that's drastic, right?
Yeah.
So what they learned to do is they learned how to moderate the immune intensity using medications and treatments and various kinds of things. And us too, having people take vitamin D to moderate the problem. So people were taking vitamin D had a 90% reduction in the chances of dying of COVID. Not getting COVID. They still get COVID.
Right.
But they just wouldn't die from COVID anymore because the immune system couldn't flare as much as it did before. Interesting, isn't it?
Very interesting.
The Crohn's is the same thing.
Yep.
We want to make sure that we don't shut the healing down because we don't want the dry rot to continue on, right?
Right.
Because there's an infection and there's reasons for that to happen. We don't want it to be so exaggerated that it blows everything up and that you no longer have a colon that you can use.
Right.
And really, that can get that bad. One of the things that happens with this is people go to the hospital and they get their colon taken out.
Oh.
And they have to use a colostomy bag
Yeah.
because the colon was so bad and so bloody they were dying.
Yeah.
So cut it out.
Yeah.
Sew it up, and now you don't have a colon anymore. Yeah, we hate it when that happens. Now, the good news is somebody gets to me before they get to that point that, knock on wood, I was able to help them every time.
Yeah.
No one's had to lose their colon under our care. So there's that. So it's possible. So people listening, I want you guys to know that there's a way to get into this thing. There's a strategy. Now, you can't necessarily learn how to do it in a half hour on this show, but you can at least get the idea that it's doable, and then you could go find somebody trained like I am, right?
Get information to bring back to your doctor to bounce these ideas off of them and see what they have to say.
Yeah. So steroids, I'm not totally against. I mean, sometimes if you're dying and you remember the 30 carpenters thing, we got to fire 28 of those carpenters right now.
Thing, yeah.
That's steroids.
That's steroids, absolutely.
Out the door.
Saving the best for you. So another thing I was thinking of in healing the digestive system, would magnesium be helpful?
It can be. I like magnesium. Magnesium is a super useful mineral for generating energy. It's an energy cofactor. It's the most common cofactor. That is, it needs to be there for the thing to happen. It's the most common cofactor for enzyme reactions. And we're just a bunch of enzyme reactions is what we are. That's how our whole system runs on these enzyme reactions. So if you're low on magnesium, you're going to be tired. Your whole system's going to run low. Your ability to heal is going to low. So magnesium is helpful that way. So yay, we love magnesium.
And also for its, help and assistance with smooth muscle.
It helps regulate smooth muscle function. If smooth muscles are churning like crazy, you take magnesium, it calms them down.
Right.
It acts as a calcium channel blocker, so the smooth muscle tends to relax. That's all on the plus side. On the minus side, it's really a very good laxative. And these people are already lax.
Yeah,
they got enough diarrhea going on, so you really can't give them. It fits in the same category as the fiber. Coming in hot, you can't give them any magnesium.
Sure.
Coming in hot, you can't give them any fiber. You got to calm them down so that they can start tolerating things like that.
Okay.
So one of the main things we want to do is we want to set up the ecosystem in the digestive system so that it runs well, and then the whole system, the immune system, is much calmer, and there's much less likelihood of getting the generation of bad bacteria that makes bad stuff, otherwise known as toxins. The whole system tends to be stable, predictable, safe, healing, like that. That's what we want. So how do we do that? What we're going to have to do is we're going to have people eat lots of fruits and vegetables. Why? Because it has nutrition for one thing, but it also has lots of different kinds of fiber. Mm-hmm. And so you get a variety of different fibers coming in because you eat asparagus and you eat broccoli and you eat melon and you eat apples, whatever, those kind of things. Now that is a bad list for somebody who's hot with Crohn's.
Sure.
But if somebody who's not hot with Crohn's and they're trying to figure out how never to get Crohn's again, those aren't particularly special foods. They're just examples of
broccoli
of fibers, foods that are good for you.
Yeah.
So you eat those, and then each one of those fibers has a different kind of flavor to it, has a different kind of structure to it, and each one of those fibers, there's bacteria in you, a healthy bacteria, that likes that one best, and they do better with that. So if you feed them, you create this little micro niche for a certain kind of bacteria, and now you have this broad and deep ecosystem. And if something comes in, a bad bug or an antibiotic or something, and cuts out a section of your ecosystem, the rest of the ecosystem doesn't collapse, it just kind of adapts. Some of these bugs go up, some go down, the whole thing just kind of adjusts, and then after a week or two, it adjusts back, and now you're good to go. There's a resilience built into the system by having complexity. I mean, this is like the planet Earth, right?
Yeah,
we don't live on 3 kinds of bacteria and 2 bugs, right? We have millions of bacteria, millions of kinds of bugs.
Right.
And they all live working together.
In symbiosis together.
Yeah. And like that. We want to do that kind of thing. So what we want to do is have a wide variety of foods that people eat. And then when they get to the end of this thing, they'll need to take something to calm their immune system down because they've been proven to have their immune system jump the rails, right?
Yeah.
So they're going to have to always take something like vitamin D and probably curcumin and probably fish oil,
but
forever.
Like, the fish oil and vitamin D are already basic supplements that people without Crohn's disease should be taking regularly. So.
Yeah, they're the kind of stuff that if you want to live in Fairbanks, Alaska, where we're doing the show from, you have to take because otherwise you don't function here.
Yeah.
So, anyways, normal stuff. They take these normal kinds of things. And then they'll need to eat a wide variety of foods and really go out of their way to eat foods that are in season, foods that are tasty and delicious, that are healthy. You don't want to eat, bad tomatoes, wooden tomatoes, funky ones. You want to find the good tomatoes and just kind of be like normal human beings. And you just kind of strive and you engage in eating healthy food as a way to build up this ecosystem. And that, honestly, of all things we're talking about in the long run, that's the most powerful tool we have.
It's key.
To make sure you don't get Crohn's again, that you won't flare again.
Yeah.
As this is what you do.
Yeah.
Things like this. I mean, we could say more. There's a lot more detail to it.
We could say a lot
But this is
more.
the big picture. And then hopefully people listening will get a sense of how to think about this and how to move their lives closer to the lifestyle to either prevent Crohn's or treat Crohn's.
Yeah.
Now, I'm not saying you shouldn't go to see a doctor. You should. Absolutely, positively. There's all kinds of medications that are not bad. Sulfasalazine, for example. I like it. Works pretty good. It knocks down the flares pretty nicely. Steroids I'm not so into, but steroids are a lifesaver in a certain situation. You just can't depend on them. You can't stay on steroids forever.
No.
And once you get the flare calmed down, then you come in with these common sense things that we're talking about right now, and you get a case to turn, and you live well. You can see when we talk like this, it seems so logical, right? And so sensible, because it is.
Right.
And that's why it's not really that hard to treat. Somebody comes in with Crohn's, I go, oh boy,
Yeah.
another one I'm gonna fix.
Yeah, we've got this. We've done this before. Well, I think we have run out of time for this episode, Dr. Luper.
Well, thanks, Haley. I
Yes.
appreciate you bringing this up and creating the opportunity for us to talk about this.
Great. Thank you.
Thanks for tuning in to another episode of Sensible Health Solutions. We hope you found today's discussion enlightening and packed with practical tips to enhance your wellness journey. Remember, small changes can lead to big results. If you enjoyed the episode, don't forget to subscribe and leave us a review on your favorite podcast platform. Your feedback helps us bring you the best content possible. Stay connected with us on social media for more health insights and updates. You can find us at Sensible Health Solutions across all social platforms. Until next time, stay sensible and stay healthy. This content is for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Seek medical advice from a healthcare professional for any medical conditions.